Hi everyone, I'm Tori.
I'm Reagan.
I'm Lexi.
And I'm Cheyenne.
Today we're going to show everyone how to apply compression devices.
Walk in the room with the supplies that you need, perform hand hygiene, and introduce yourself.
Hi, my name's Reagan. I'll be your student nurse today, and I'm going to be putting on some TED hose.
Ensure that this is the correct patient.
Hi, what's your name? What's your birthday?
Raise the bed.
And she's in a supine position.
And lower the guardrail. Expose legs, linens up towards thighs. Ensure to not overexpose. Select stockings. Ensure that they are the correct size. Stockings that are too loose don't promote venous blood return to the heart. Too tight of stockings affect circulation.
Now that I have the right size, I'm going to find the heel flap. And I'm going to turn it inside out halfway through the heel flap. So take your hand, run it through here. I like to pinch, but you can do anything you want to get it there. Pinch, inside out, and crease. And repeat for the other one.
Pull stocking up to heel. And then pull stocking up to the rest of the leg. Grab an extra set of hands if needed.
So I'm gonna check to make sure the heel is in the right spot. Looks good. Pull up excess.
It is important to ensure that there are no twists, creases, or wrinkles after application. Twists, bunching up, or rolls can affect circulation. Creases and wrinkles can cause skin breakdown. This same process works for a thigh-high TED hose.
Now we're moving on to sequential compression devices, aka SCDs. The nurse will gather supplies, perform hand hygiene, identify her patient with 2 identifiers.
Will you tell me your name and date of birth?
And verify physician orders for the SCDs. Ensure patient is in a supine position and raise the head of the bed. Assess patient's legs for scratches or cuts. Make sure legs are warm and assess for pedal and popliteal pulses. You will place the machine on the edge of the bed and ensure the sleeve is correctly sized. Then you line up the ankle with the inner lining of the sleeve and align patient knee with the popliteal opening on the sleeve. Wrap the sleeve securely, making sure it is smooth. And check by putting 2 fingers between the leg and the sleeve. Attach the connector to the machine and line up the arrows. Turn on the machine, green light indicates it's working. The nurse will monitor through 1 full cycle of inflation and deflation. You will remove the SCD once per day as long as necessary to assess for skin breakdown and irritation. Okay, first the nurse will perform hand hygiene upon entering the room. Then the nurse will identify the client with 2 identifiers.
Can I have your name and date of birth, please?
And then the nurse will review orders for specificity of applying the roll. Examples are area to be covered, the type of bandage required, frequency of change, and previous response. And then the nurse will elevate the legs for 15 minutes before applying the bandage to reduce swelling. Uncover the patient and make sure everywhere is covered besides the area that you need. Then the nurse will palpate for temperature of skin, observe skin color, find the pedal and popliteal pulses, check for presence of edema, and check sensation. Hold the roll in your dominant hand and use the other hand to lightly hold the beginning layer. Begin at the distal point and go towards proximal to the heart. Overlap each layer by 1/2 to 3/4 the width of the bandage. And secure the end of the gauze with tape, clips, or in this case, Velcro.
Before you leave the room, ensure that the bed is low and locked, call light is within reach, patient is comfortable,
Are you comfortable?
bed rails are up according to your facility policy, and perform hand hygiene.
Compression devices are an important skill because they promote adequate blood flow, they prevent DVTs, also known as blood clots, and they decrease edema, also known as swelling. Compression devices can be used for any patient with reduced mobility, including but not limited to post-surgical patients, stroke patients, or bed-bound patients. SCDs, or sequential compression devices, function by first inflating to pump blood through the deep veins, then deflating to allow the veins to refill, which promotes adequate blood flow. The only difference with ACE wraps and TED hose are that they are not connected to a machine that allows them to inflate and deflate. Compression devices can be applied to every part of the nursing process. Let's say your patient has just had a stroke. For the assessment portion, you would note from the patient's history that they had a stroke yesterday and have reduced mobility. An example of a nursing diagnosis could be reduced mobility related to a recent stroke as evidenced by limited range of motion on one side. An example of a SMART goal for the planning portion would be to apply compression stockings to the lower extremities to increase blood flow and decrease the chance of blood clots over the next 2 days. The intervention would be the actual application of the compression stockings. And for evaluation, you would make sure the compression stockings are working. So evaluating your patient for signs of an acute DVT, such as pain or loss of perfusion.
Nurses use this skill to prevent blood clots. This is especially important with patients or clients who are bedbound or not able to move well on their own. This can be due to old age, or it is also used as a preventative measure after surgery.
What should a nurse know before applying compression devices? First, the nurse should confirm provider's orders, including specificity, type, frequency. The nurse should also assess for any open skin lesions or to the area or a recent skin graft to the lower leg. Next, 3 and 5 kind of combined here, but patient history. So any current or a history of peripheral artery disease, congestive heart failure, or acute DVT might question whether or not compression devices are used. Finally, the nurse should ensure that adequate circulation is to the area. For example, if a patient has decreased peripheral circulation, compression devices may not be used.
Nurses can use these devices to complete assessments. One assessment is a skin assessment. When applying these devices, it is easy to notice the skin surface. Look for any redness, discoloration of the skin breakdown, or pressure ulcers, especially in the areas around the compression device. This is especially important if you notice that the device was applied incorrectly. You can also complete a circulatory assessment. Palpate the distal pulses to assess the blood flow. Are they the same on both sides? Track this over time and notice any abnormalities. Can you compare the temperature on both sides? Is it the same? Notice anything else that can indicate poor circulation, like color and capillary refill. This is especially important if one side is affected, such as a surgery or injury. You can also assess for edema and notice if this is in any specific area. Pain is another assessment, and especially important if there is any pain or discomfort related to the compression device. Maybe this is just a comfort assessment to ensure that the fit of the compression is proper and there are no adjustments that need to be made. History assessment. Has this patient had a history of a blood clot or DVT? Are they on any anticoagulant medication therapy? This is important to know so you can identify any potential risk factors for DVT. The application of ACE wraps, TED hose, and SCDs can be delegated to assistive personnel. However, it is important to ensure that they are trained specifically on this job, and they must understand what to look out for during application and report any edema, redness, sores, or anything else that is important to note during a skin assessment. With this being said, assistive personnel applying compression devices can be seen as a missed opportunity for the nurse to complete a skin assessment, as it is the nurse's role to complete assessments. If assistive personnel apply these devices, it is important for the nurse to follow up with the patient to ensure that it was applied correctly and assess for any pain or discomfort.
Some instructions to give the patient when they are applying TED hose or ACE wraps include apply the wraps smoothly. You want to make sure that there isn't any wrinkling or any excessive tightness. Check for tingling, numbness, or increased pain in the extremity that has the wrap, because this can indicate impaired circulation. Ensure the wraps don't become too loose or begin rolling down. Remove the wraps periodically to inspect the skin and to reposition, and check the comfort level of the location that the compression device is on. These compression devices should never feel uncomfortable. Some instructions to give the patient when applying sequential compression devices include keeping these on as much as possible. These should only be taken off for bathing or ambulation. Do not disconnect the tubing from the pump. Ensure that the cuffs inflate and deflate properly on a cycle. Report any discomfort, pain, or skin irritation from the sleeves, and the patient should utilize their call light to get assistance before trying to get out of bed. That way they avoid entanglement with the tubing. Some signs and symptoms of complications related to compression devices include numbness, tingling, increased pain, or discoloration. These all indicate impaired circulation. Excessive swelling or firmness of the extremity that the compression device is on, blistering or skin breakdown, and these are caused by improper fits or wrinkles in the compression devices, and dizziness or shortness of breath relating to compression devices being too tight. Assessments that can be done when applying compression devices include ensuring the patient is getting the right size compression device. Check the skin for any existing skin conditions, wounds, or areas of breakdown. These could be exacerbated by the compression device, and ensure that circulation to the extremities is at an adequate level before applying the compression device to the extremity. Some ongoing assessments that can be done after performing the application of compression devices include continuous monitoring of swelling. Make sure to take note of whether it's lessening or worsening. This will help make sure that the compression device is still effective. Continually check skin integrity while the device is on. Continue to ask the patient about their pain levels and adjust the sizing or amount of pressure as needed. And continue to check for any changes in sensation, such as tingling, numbness, or the feeling of pins and needles.